This is Becoming Inclusive from the Kaleidoscope Group, where we're thinking differently about diversity, equity, and inclusion for more empowered people at work. We're committed to real change, and that begins with real conversations. Welcome in.
I'm Reginald Ponder, and welcome to another edition of Becoming Inclusive. I am here, of course, with my co-host, Catherine Potts. Hey, Kat.
Hello, everybody.
And today, we have a guest that we haven't had before, and that's for Fariha Siddiquie, and she is a healthcare consultant for the Kaleidoscope Group. And so, welcome, Fariha.
Hi, Reggie. Hi, Kat. Thanks for having me today.
So Kat talked to me about, Reggie, we're going to talk about healthcare, and just so you know, this is a topic that's really near and dear to my heart because I grew up here in Chicago and we used the hospital. I have 8 brothers and sisters. My mother raised 8 of us by herself, and we used the hospital as our doctor. So the only time we saw a doctor is when we went to the hospital. So that meant going to the emergency room. And so to this day, I say to my wife, I'm going to the hospital. And she laughs at me because I'm not going to the hospital. I'm going actually to see my doctor. But this whole issue of healthcare and healthcare equity is so important to me because I saw firsthand the disparities that my family received as it relates to healthcare because we did not have insurance. And also saw the impact that had on the healthcare system with so many people who didn't have insurance doing all that. I know we're not talking about that specifically, but the issue of healthcare equity is embedded in all of that. And we could see that when we were kids. I didn't go too far off here, did I, Fariha?
Nope. I think, you make a great point. Health equity, and, there's so many different podcasts we can do about health equity specifically. We can go into so many different areas of exploration with this. One of the big things that we have to realize is that health equity, there's a person behind it, right? This is a topic, a key word. It's, an idea that's gaining a lot of popularity. But it's not a new topic, right? It's been around for decades. It's been around for centuries. Health equity is the idea that, all people should have access to healthcare in an equitable way. So that means, you look at different determinants of health. That's what we call it in the public health world, social determinants of health. One example of that is, an easy one is geography. So, for example, someone who lives in, southern Indiana who may have to drive 3 to 5 hours to see a doctor is going to go to the doctor less, is going to, have a more exacerbated issue, have worse symptoms when they go to the doctor because it's harder for them to go compared to someone like me who, I used to live really close to the medical district in Chicago. So I had, my pick of hospitals, my pick of doctors. I could go in, if I had a paper cut, I could, go to the urgent care, the ER. And so, geography is just one example. There's so many different disparities, right? There's race is a big one right now. There's ethnicity, there's language, there's income level, there's housing. You talked about insurance. The type of insurance you get is also impacted by, are you a citizen of the United States? Are you on refugee status? Sorry?
Yeah, if jobs are offering it, because not everybody even gets it offered through jobs, so that makes it difficult too.
A great point. And, even political opinion is now a factor, a determinant of health, of whether you receive healthcare or if you choose to receive healthcare. And so, I see, a lot of great change in our nation right now. I like to call it the collective level of introspection that's happening in terms of race issues and social justice issues. And you see topics of health equity coming up more in bigger spaces, right? Like the CDC, the American, Hospital Association, medical journals, prestigious journals are now publishing all of these, research papers now on health equity. But in order to solve health equity issues, you have to, I say you, but I mean we have to really look at the person behind, the labels and the facts and the statistics, and really think about what factors are impacting them.
Well, too, really quick, I just want to go back to that experience, because even now when you go to the doctor, they want to see your insurance card before they'll even let you see the doctor. That's like number one, fill this out. They'll send you 10 million reminders on your phone, on your email when you get there, just to make sure that you have insurance, or how are you paying for this visit? And then they'll ask you the questions about why you're actually there. And that seems backwards. But Reggie, I know you had a point.
No, I actually was going to say, before we really get into how to solve for it, I did want to spend just a little bit more time on this whole, because you talked about all these dimensions of that might impact health equity. And I just saw a report about how I don't even know if it was suburban. It's not suburban, it's rural areas, how access to healthcare is getting so tough in many rural areas that this woman particularly, she was pregnant and she had to drive an hour and a half to have her baby delivered.
My friend was like that, actually.
That's,
yep.
If there's anything called a complication, that's very, very life-threatening and problematic. Then you talk about income. Income definitely impacts it, because you just talked about this, Kat. If you don't have insurance, if you can't pay for it. I saw another report how hospitals charge gazillions of dollars for people who don't have insurance. So even if you have a little bit of money, the amount that they charge you as an individual versus the amount they would charge you, because they can push at least 80% of that off on the insurer, becomes difficult. So I really like the fact, Fariha, that you outlined all these different things that may impact it. And I just want to throw in another one, because I have seen that our LGBTQ community having some real issues in the healthcare space as it relates to health equity as well. And I just didn't want to leave that one out as well.
That's very true. And, you all bring up great points, because when we talk about health equity, we like to center the topic on empathy for the patient. And we forget that, sitting here, it's very easy for me and you to talk about, the physician should have empathy. And we can guilt the physician or the healthcare worker, the nurse, the PA, whoever it is, for not having enough empathy. And you look at the healthcare system the way it is right now, with, we're 3 years into the pandemic, there are, shortages in so many different levels and different ways that it's actually kind of, impossible to have empathy in the patient room right now, when you have all of these things that you're working against, right? You're facing insurance companies that are denying your treatment plan, so you can't treat the patient that you care about. You have a list of 40, 50 patients to see in a day. So the most that you can do is spend 5 minutes in a room, and you just say this, and that, and you got to leave. Otherwise, the rest of your day is off track, right? There's so many issues that prevent empathy from happening in that patient room, that really, in order to solve for health equity issues, you really have to think about DE&I in the workforce and the workplace in terms of healthcare systems. So I always like to say you can't what's the term? You can't share from an empty cup.
Oh, you can't pour from an empty cup. Yeah,
I was going to say it, and I forgot.
it's okay. We got it. Basically, you have to have something in your cup. That's
You have to have something in your cup, and right now there's nothing in there. You know, you want to be glass half full, half empty. Right now, there's nothing.
And I think that this is an important point, because when we talk about the things that need to be in place for health equity, is more than just what the physician and the people who might be treating us need to bring to the table. They need support as well. And I am so happy that you bring that issue, because I could see the healthcare worker saying, well, I got this, I have all these things to do. And it sounds like an excuse, but it's really,
there's two sides to it. There's two sides. It's the provider and it's the patient, right? So it's like there's two, you have to have empathy for both. There's two groups of entities that you have to worry about. It's not just one or the other. And I feel like that's sort of the constant struggle too, right? Who do you prioritize? When really there should be equity across all of the planes. It's difficult to do that, especially too, and this is another facet we don't have to dive into right now, but like having a lot of pressure on healthcare providers, but then God forbid something happens, the consequences for them are so great. So it's like we don't have empathy, we don't have equity, but the consequences, whether it's in a form of someone losing their life or someone losing their job because they were trying to save a life, being overwhelmed, creates a whole nother facet of this when it comes to healthcare equity.
Yeah, and Kat, you really opened Pandora's box there when you talk about equity in healthcare systems, because, you know, obviously there's issues like pay equity. Resident physicians, if I was to go into residency the way that I had planned to, I would be making $3 to $5 an hour compared to how much I would work, right? That's not a livable wage. I would have no time to spend with my friends, with my family. I would have no time for myself, right? To regroup, to sleep, right? To even sleep. You have people coming off of 24-hour shifts, and the pressure to perform in a life-saving, situation is there when you're not even able to take care of yourself. So equity in the healthcare system, it starts at a basic level of, treat your healthcare employees as human beings and not as machines.
That's good.
I'm really glad that you bring that up as well. My niece is a resident, and some days she comes home from the trauma she has seen. It's amazing, and so it's really interesting that she has that empathy. But it also creates another issue. When you care so deeply, when you are really in there for your patients, and then you see the outcomes are not the outcomes that you hope for them. And many times, because of what you said, is that, okay, I haven't been to see a doctor because it's not close. So when I finally come, the severity of my issue is at a 7 as opposed to at a 2, when maybe they could have done something differently. So I watch her sometimes when she comes home, and it's tough. It's really tough.
Mm-hmm. Well, I'm sure she appreciates that you are there to be empathetic towards her.
Yeah, we'll take her over a little cake every once in a while. Try to let her. She lives very close, so we do try to lighten the load mentally, because that's important. So let's get into it, because we have a little bit when we talk about solving for health equity, and you have some. Go ahead, Kat.
I'm going to come in really quick. I want to say I think the challenge is how to be empathetic in a system that is controlled by an entity that isn't rooted in empathy. It's rooted in business. And so really getting into that, I think, would be interesting, because how empathetic can you be when you're giving guidelines? You have to do something. You can't help somebody. Well, what do we do in that case? Quickly, for example, the pediatrician my son goes to, even though she accepts insurance, and there's a copay for people, she actually allows parents, if they can't pay that copay right away, she lets them go on a payment plan, no interest, lets them pay she's found a solution. But that's not possible for every independent practice. Definitely not a hospital.
Yeah, and a lot of times when physicians, clinicians are showing kindness and leniency and things of that nature, they're actually eating up the costs of the medical procedures, and these aren't cheap procedures, right? So it's a struggle, because even if you want to have empathy, you have to also make some hard decisions, right? You can't save everyone. That's one of the hard lessons you learn as a physician.
So you talked about how to solve for health equity, and I'd like for you to get into that a little bit.
Right. So, people like to think of health equity and DE&I in different buckets, right? There's patient facing, and then there's workforce, workplace, there's organizational change, and there's, patient change, science and medicine. Really, I see them as interconnected. If you want to solve for health equity, you have to also take care of your workforce and your workplace and your policies, your procedures. We talk about DE&I in the workforce, the DE&I in the healthcare workforce. You have to have diverse representation. You have to have equitable policies and practices, and you have to also be inclusive. So, I see in the past, couple of years, the amount of diverse representation has really increased. Obviously we have ways to go, but I'm seeing, underrepresented minorities in places that were never like that before, right? You have, underrepresented physicians in the boardroom and in Ivy League, and it's great to see. But, at the same time, there's a study that shows that Black physicians in residency are twice as likely to be dismissed from their program than their white counterparts. And so that goes into inclusivity.
Wow.
You have diverse representation, but are you being inclusive? Are you being equitable in terms of, your performance evaluations, your mentorship, your leadership? So I'll give an example of my own self. I am an Asian American woman. In my culture, the way I grew up, I was taught, you have to be quiet. You can't speak up. Obviously, I break those rules all the time. I was a rebel. But you can't speak up against your elders. You have to sit quietly, look down, don't make eye contact, keep your hands folded, don't make noise. So when I was in these educational systems, I thought it was a sign of respect to treat my superior in that way. And that was showing up in my performance evaluations as, Fariha doesn't care. Fariha's not interested. Fariha's unprepared. It was only until one of my attendings sat me down and said, "Why do you do this?" And I said, "Well, this is what I thought I had to do." And she was like, no, don't do that. Do it like this. This is the unspoken rule of medicine that you don't know, because, you don't know anyone in medicine. You were never taught this. But this is how you're supposed to act. And as soon as I found out, I was like, oh, okay. And my performance evaluations changed instantly. So that's equitable and inclusive, leadership, mentorship, and training, accounting for differences and having a conversation rather than just punishing. So having, conversations like that and thinking about those things, that's the next step after, pooling a diverse candidate, having diverse representation in your residency and your staff in your boardroom. That's wonderful. Great strides are being made. how are we now taking the next step of being inclusive and equitable?
What I'm thinking of too, though, when I hear your story, though, is yes, there was a level of inclusion for you, right? They were trying to appreciate the background that you came from, and also, show you a different way to function that would be beneficial for you, right? But then I wonder too, though, isn't it a little bit exclusive to say that there's this certain way to be to get to from A to Z, right?
Yeah. And that's a deeper issue. That's something that I don't know if we can solve in one day with healthcare in particular. It's a very traditional, and it is the way that it is, and it's hard to change it. We'll just keep it at
Right.
that. And so and it's in all different types. It's not just race, it's the amount of rest that you are allowed to get. It's motherhood and fatherhood and training and in the field. There's a lot of different people and factors that are impacted by the way the culture of medicine is.
Right. Yeah, I mean that's what I hear you say. Basically, your story is, you had to sort of pivot to what this norm may be in healthcare to be able to move up. So it's like there's even opportunity from that. Yes, that was beneficial for you. You were able to get through and do what you had to do, but there's even room for that area to grow on, like, we can't have everyone just pivot to this like way that people need to be in the in crowd, in medicine. But I can appreciate at the same time, though, like sort of meeting people where they are, right? You did what you needed to do to be able to maybe get to the next level, to get to a level of being able to influence and do what you can do to kind of break through that, right? Because that's the thing too. Like you said, you're not going to be able to just like, snap your fingers and change an entire culture. But perhaps once you're able to kind of get into it, then maybe you can make that change.
Yeah. And, I hope that, if there's any healthcare leaders listening, that they hear that and they are inspired to make some changes, and the time to change, if there ever was one, is right now. People like to think of burnout and employee, resignation and all of that in a separate sphere as well from DE&I. People like to think of DE&I as race issues, and that's that. But employee burnout in healthcare, because of all of these factors, there's an estimate that 1 out of 5 physicians are going to leave their practice within the next 2 years.
Oh, wow.
And so that leaves us, right? It leaves us without doctors to care for us. So if we care about health equity, and even that, if we care about keeping our healthcare systems running, we have to care about DE&I in the workforce and workplace.
So Fariha, I always push this point in all of our discussions, is this issue of we need diversity to achieve health equity. And when we make these statements, I hear the naysayers saying, well, why? And so I want to ask you, why do we really need diversity? If you have the technical, you go to medical school, you have the technical skills, you have the ability to bring empathy, you have the ability to diagnose what the issues, and you have a great team around you. Why do I need diversity?
That's a great question, Reggie, and I'll answer that with an example. So one of the facts that is known in the textbooks, someone with a lot of knowledge in healthcare would know this, is that diabetes is more prevalent in African Americans and Hispanic communities and indigenous communities compared to their white counterparts. So if I have a Black person in my clinic, and I know that this fact, I know about this, I'm going to check their blood glucose level. I'm going to, counsel them on their diet. I'm going to teach them about their medication options. But if I don't know them, if I'm not representative of this person, I'm not going to understand them at a different level. So what factors have impacted that person before they came into my clinic? And what factors are going to impact that person once they leave? Is this, higher occurrence of diabetes because of a physiological issue, or is it because of a language barrier? Is it because of a cultural way of looking at health and lifestyle? Is it because this person lives in a food desert? They don't have access to healthy food. Is it because there's historical mistrust of healthcare system? Is it because they just don't know what diabetes is, or they don't know how to use their medication, or they don't have access to medication? These are all questions that I wouldn't think about if I'm not representative of the person that I'm treating, right? It's not going to be automatic to me. It's going to be something that I have to sit down and really think through, or, ideally have a conversation with about the patient.
Those are honestly though, Fariha, those are questions I spend, 20 minutes filling out intake forms. What's another 10 minutes with questions like that on there, so that, yes, of course, have the conversation, but those are things that should be, in someone's file, because sometimes you get a call back from a physician about something, or they have to tell you how a result is. You don't get it right then. And so honestly, they don't remember every little detail. You know what I mean? I'm impressed sometimes that my doctors do. I'm like, oh, they remembered that. But that's rare. And to have that information on someone so that you can help make the best decisions for them. Like you said, what do they have access to? What's realistic for them? Does this really make sense? Do I really need them to come in 10 more times? How do I expedite this because they don't have a car? That's where we start really making it personal. And like you said, putting the people in healthcare.
Yep. And I love that idea, Kat, because, we talked about working within the system that we have and understanding its limitations. One of the limitations is someone who is caring for a patient will not have the time to ask those questions.
Yep.
And you came up with a great way to solve for it. Just include it in, the intake. Love that idea. Hope someone listening takes it somewhere.
I had a good idea.
And I want to add to the question that I asked as it relates to why diversity is important, is that the diversity of experiences means that your entire team has, when you go back to your team and you have a woman on the team, a man on the team, a Black person, a Latino person, hopefully that diversity of experience will all have you guys saying, well, maybe it could be this. Well, maybe it could be that. But if you haven't seen the diabetes as much because that hasn't been in your community or what you go, you're going to go textbook. You're going to go straight textbook, and you might not ask all the questions or think about all the things that you brought into play, Fariha. And then I wanted to add in one other thing too, is that studies have also shown that the reason diversity is very, very important in healthcare is from the patient's perspective, is that in many cases, the patients have a heightened level of trust based upon the person either looking like them or in some kind of way having an identification with them. So there's these two things. The first one that you bring up is in terms of the experiences that the physician or the healthcare provider brings, but then there's also the experience that the patient brings to it, and both of those things come into play. And that, I think, really says why diversity is very, very important when we talk about healthcare.
Yep, and I'm glad that you brought that up, Reggie. You came prepared with the studies, but right, there is that factor of, I'm going to trust someone who looks like me, and that exists, everywhere, not just in healthcare. And patients are also shown to follow through on their doctor's orders more regularly when their doctor is representative of them as well. So
I have a quick example, just really quick, I want to use. Is like, I have a male OB, and people be like, oh my gosh, but he's so amazing because I know so much about his wife, because that's how he tries to connect. He said he always will bring up his wife, because he'll like, he can't really, obviously relate to certain things, but I know so much about his wife because he uses that and her experiences not to out his personal business, but because he realizes like there's no personal stories he can tell about himself to, make a woman totally feel comfortable. But if he, that humility of like, but I know this because of this, and I ask these questions, like I've referred a million people to him because I'm like, I've had a better experience with him than women OBs, which is shocking. But it's because of that extra step, right? So I just wanted to share that example.
Yep. Yeah.
Well, go ahead, Fariha.
I was just gonna add, growing up, I had a pediatrician who, my parents are Pakistani immigrants who, struggle with English, struggle with understanding the systems in the US, right? They're new to it, and they don't really have many people they can ask for help with those things on. So my pediatrician growing up was also a Pakistani immigrant, someone, in our community that we knew. She came to my birthday parties. That's how close we were. It was a little bit too close. But, that level of trust is important for people like my parents who don't know who they can trust in a new country. So that is a great point.
Well, this is not really related, but you just made me think about my children's pediatrician, Dr. Sally, who I just have to say his name because he was the best.
Dr. Sally.
I wanted to leave my doctor to go to Dr. Sally because the biggest thing that you talked about is empathy, and the empathy that he had for trying to really understand young people. It was amazing. He would sit there and listen to them. Mm-hmm. And I think in many cases, it might have been some of the few times that young people were really listened to, because, as parents, we tell them what to do as opposed to really listen. But Dr. Sally really listened to them. So I love the fact that you put out there this thing about empathy. And I think because Kat runs this thing, I think we'll be having another thing talking about empathy just in general, because I think it's
maybe active listening, because what a concept. Shocking that it could be so helpful.
Yeah, absolutely. And the impact that really has from someone who is in a position of power and prestige, as your doctor, to see someone who looks like you in that position, and someone who is listening to you and values you and cares about your outcome. So, to any doctors that are listening to this who are able to do that, especially right now in the system that we have right now that is very, very broken, round of applause for you all. That comes from, the bottom of my heart.
Wow. Say, Fariha, thank you so much for joining us. This is called Becoming Inclusive for a reason, because it's a journey. We don't have all the answers. And that's how come we talk with each other. We try to get all these different perspectives, because we learn from each other by having these different perspectives. I want to say again, thank you to Fariha for coming and being a part of Becoming Inclusive. And there, as you have it, my co-host, Catherine Potts. Thanks, Kat. And we will see you guys next time.
Bye, everyone.
Bye.
Thanks for joining us, and a special thanks to our subscribers. Consider becoming one today. Becoming Inclusive is presented by the Kaleidoscope Group, your full-service diversity, equity, and inclusion partner serving clients worldwide. Learn more and continue the conversation at kgdiversity.com.